Welcome, everyone, to this episode of Smarter Sourcing. My name is John Pavia, and today we are joined by Ben Haygood, who's the Director of Strategic Sourcing for Piedmont Healthcare in Georgia, the largest healthcare system in Georgia. Ben, thanks for joining us.
Thanks for allowing me to be here, John. Excited.
So listen, I want to, there's so much going on in the world right now, and I'm interested to hear about how it's impacting the healthcare system and healthcare supply chain, sourcing and procurement. But I want to start first with you personally. Tell us about your journey, a little bit about your background and how you got to be the Director of Strategic Sourcing at Piedmont.
Yeah, I've been in healthcare supply chain for about 25 years. Helps me remember how old I am. I started when I was 19. I was living in Louisville, Kentucky, and I started on third shift, putting up supplies in an ER. It was a good job at that point, and I ended up staying with it. I came to Atlanta.
How'd you get that job to begin with?
I ended up knowing somebody who worked in the hospital. So like many, many jobs, right? It's who you know. And I ended up coming on as that third shift job because it fit my schedule. I was going to school full time as well, and started putting up supplies and working in operations, filling out stock rooms in the ER.
At any early age, did you get to see a surgery?
Not that early, although later I did, and that helped solidify for me that I did not belong on the clinical side. It's not for me. It's for braver souls out there. I ended up moving to Atlanta in 2002 and got on with the facility here, and kind of went through the many of the positions in supply chain operations, putting up supplies, then shipping and receiving, managing a team, and then got into the OR space and spent about 8 years there, specifically at OR materials management, which includes a lot of implant ordering, a lot of putting out fires, making sure surgeons have the things they need.
Let me ask you this. So this is odd in a way, because most of the people we have in the show, they have a career and then they're on their path, or they're on some path, and then they end up, there's a need in sourcing, procurement, and they're like, sure, I'll do it. And they end up spending the rest of their career in sourcing. That's not the case for you. So you were 19 years old. You first get into it at that point, but you're also going to school. So did you marry the two? As like in your head, did you say to yourself, hey, what I'm doing to make ends meet at 19 and helping to put yourself through school, this could actually be a career. So let me advance it through my studies, or that there were the two things divorced from each other at the time?
No, that's a great question. It actually came together a little later in realizing that the thing that I was focused on in studying, I was majoring in English. I was very interested. I was always a reader. I was very interested in pursuing that route, potentially teaching. But it was very vague, right? At 19, like many ideas at 19, very vague. And so as I proceeded on, I realized, and of course proceeded on in personal life, got married, started a family, that going that route is going to take a while to put yourself in a stronger financial position. And so understanding that I had this experience and also had aptitude and really understanding the value and purpose of healthcare supply chain specifically, it helped change my course, and I really couldn't be happier with the decision that I made.
Did you have any mentors? I mean, I'm sure you did. Did you have anybody in particular that stands out as someone who gave you just some great guidance?
Yeah, many times. As I started on, I was brought in by, again, someone that I knew in the healthcare system, and I had the opportunity, I didn't realize then, but because they had a personal connection with the chief officer at that time of that health system, I was able to interact with him and establish a reasonable relationship that it's not that common for like a second shift stock guy. And so as I began talking, I was able to learn a lot more from that and understand the various roles in supply chain, and started to understand how I may be able to apply my own talents to and capabilities to those roles.
That's a great story. What about yourself now? Let me start with this. When you think back, what would Ben Haygood today, what advice would you give the Ben Haygood of 25 years ago, as we're starting out in this?
I think that's a great question. I think the Ben Haygood today would say, hey man, there's a lot of folks that believe they were going to write the great American novel. You're not going to be that guy. So let's go ahead and get out of English quicker and get after it. And it's okay.
So tell us about your job at Piedmont Health today. Maybe start with the structure of your organization and of Piedmont in general, because it's a big organization. And as I said in my intro, I think it's the largest healthcare provider in Georgia, right? And so it's a big operation. So tell us a little bit about start with Piedmont and then your particular organization.
Yeah, sure. It's actually a little bit of background. I've been with Piedmont a little over 8 years. And when I came on with Piedmont, they were 8 facilities. So over the last 8 years, they have tripled in, so more than tripled in size. So as I mentioned, we're 27 hospitals in Georgia, largest one there. And, Piedmont has been a little bit unique in that I think many of us know that COVID shined a fairly bright light on supply chain and generally across all business categories, right? But Piedmont in general has always had a fairly good support for its supply chain department. A lot of that has to do with our chief officer, who is at the top of our supply chain. He's been here for 18 plus years. And that leadership has actually helped provide that unifying vision during the time of growth for Piedmont. And so, as I mentioned, the chief officer is the top. He is over both strategic sourcing, our department here, but also under supply chain, and included under his leadership is biomedical, public safety, and project management. And that's an interesting, I don't know if that's as common in the healthcare world as it is for us, but having that single leader over that group, as well as all of supply chain, both operations and strategic sourcing, as well as contracting, really provides some unification of those purposes and how those groups work together.
That's interesting. So there's two things in there I want to go into. Second will be the acquisitions and integrating your acquired companies. But the first part, you mentioned, the experience everybody went through during COVID, during the pandemic, how it shined the light on supply chain, sourcing, procurement, et cetera. And as we sit here today, supply chains are now beginning to be disrupted in various industries because of what's going on in the Middle East. Has it impacted you at all yet?
It certainly has, right? As all of us have been impacted. So we are already, actively reviewing some of the areas of significant impact. Recently, probably the most significant has been the impact to helium supply worldwide, as well as nitrile, which is a key component of many exam gloves. And so those were areas that, early on, I think one of the benefits of having been through COVID worldwide and some of the improvements that we've seen is that we seem to be better at early notification. Some of our partners are also better at, both technological capabilities to help us understand those challenges early and understand the potential ramifications of those challenges.
How about when it comes to your own internal preparedness? And I ask this question because of others that I've spoken to who have talked about since COVID, they spent a lot more time sort of wargaming and pre-planning for what to do in case of, and then fill in the blank. So, number one, do you guys do more of that since COVID? And if so, has it actually not paid off?
Absolutely. I think it's a great way to put it. So we have about five or so years ago, Piedmont built out its own self-distribution model, so centralized distribution center. It's a 300,000 plus square foot building that allows us to really leverage that space to make sure that we are fulfilling our primary purpose, right, which is having the right supply at the right place at the right time. And so using that, we have built up critical supplies inventory during that time to help weather the inevitable disruptions that we face, such as what we are facing now, right? So we built up PPE, as a lot of people did. We probably have a bunch of random PPE like a lot of people do. But we also built up other areas. For instance, when Hurricane Helene hit North Carolina and damaged the Baxter IV Solutions facility, that was a significant impact to that specific category because Baxter does so much business across the world. And so we were actually, bad timing, we were actually in process of transitioning to another supplier as our primary supplier in that space. But because we had that distribution center, we were able to really build out significant inventory that helped us both weather the impact, the supply disruption from the damage from the hurricane, as well as help us make the change that we were already in progress of making.
So let's now go to some of the acquisitions, and not anyone in particular, but what was your first experience with having to really either quarterback or play a major role in integrating a newly acquired company, a newly acquired healthcare system that Piedmont brought into the mothership?
Yeah, that's a great question. So early on when I first came on to Piedmont, I was primarily in a commodity management role, which is, one of the team members that I now manage. And so in that role, I was focused on surgery departments and surgery supplies, fairly large category, a lot of orthopedic. So one of the facilities that we acquired did both pretty heavy orthopedic business as well as cardiovascular business. And in that acquisition, understanding the need to be very agile when it comes to both sourcing and contracting, understanding how we need to take in the entire situation of an acquisition and understand how that ultimately, again, just like we relate all of our activities in supply chain, how that affects the patient, right? And so, for instance, if we acquire somebody and our goal is to say, you got to get on our contracts and you got to get on our contracts now, that isn't always the best practice. And perhaps that creates some disruption that ultimately affects a patient trying to get a case scheduled. So for us, our focus and what a learning aspect for me was, hey, we actually need to keep them, even if it isn't the most cost advantageous position. We need to keep their contracts whole. We need to keep supplies and engagement from vendors functioning so that the patient experience is not disrupted in the least. And that, I think, was a great learning experience for me and something that I've carried over into future activities as we've acquired additional facilities.
I think having gone through several acquisitions and integrations, it's so important that the integration, that what follows the acquisition, that it goes as smoothly as possible. Not just because of the disruption at the human level, but really how it translates in your business down to the customer. Your customer are patients who are at your facilities to get medical care. And you said something before that was interesting. And I asked you about your first time you saw a surgery, and your comment back was, but it actually helped you understand a little better how your job and what you do translates down to the patient. What advice do you have for others who are maybe a little younger and now getting into the sourcing procurement at a healthcare system about getting down into the field? And their field is, actually seeing how things that they're sourcing and procuring are being used out in the field in hospitals. And what would be your advice to that person about getting into the field and really, whether it's seeing a surgery or getting onto a floor and really experiencing what the patient's going through?
Yeah, personally, it is 100% necessary, in my opinion. Everybody is not going to go through the same career path that I followed, right? Where I did get those experiences through a career, through working in operations. But regardless, say you're coming out of school, you're well equipped to come in at a sourcing position. Numbers, finance, contracts, and that's your primary work that you have, right? That's great. But here we have each of our folks spend a day with our operations lead at a facility, sometimes two facilities. We have them engage with our ORs, go see a procedure, go understand, go talk to a physician and understand how a product is used and why it is that they prefer that product to other products in the market. That personal engagement, that willingness to go and see and have a conversation is critical to understanding how you can do your job effectively at a sourcing and contract level. Because it requires necessarily, with the patient being at the end of what we do, it requires a constant balance of quality and stewardship.
Do you have a story that you can share where you went out into the field, had a conversation with a nurse, a doctor, a practitioner, and because of that engagement, there was an aha moment where you went back and said, wow, I never realized that, how this sourcing this item versus this one, or making sure that they're in not in short supply, is so important.
Yeah, I think so we've recently, probably over the last year or so, developed a cadence of meetings and engagement with what we call our Heart Institute. So it's our cardiologists. Piedmont's heart program is one of the top 3 in the country. It's world renowned. And we saw a lot of value in sitting down with some of our physician leaders, along with other supporting leaders in the organization, to really have discussions on both what we're doing, new technology, new products, clinical research, as well as where we're going. and then we can bring in business discussions into that. So in having those discussions and talking with a physician, we were discussing the cardiac rhythm management category, right, which is ultimately pacemakers. That's one of the largest items in there. Everybody knows what those are. And so we were talking about what that is and learning that it's not just the implantation of the pacemaker. Of course, we're thinking about the price. There's the programmer, but then there is the follow-up, right? That patient needs to come back in for programming or adjustment of the pacemaker potentially. And that is a portion where there's consistent struggle in vendors having the capability of coming in because they have to do the programming. So their representatives have to come in to help program those. And so understanding that and understanding it's not as simple as, hey, if we just go to one or two vendors, right, we're going to get best pricing, we're going to save millions. Well, if we do that, perhaps we limit our ability to make the patient experience what it should be on the back end with, the programming issue. If a patient has to wait 5 hours or 4 hours because they need to have this program adjustment for their pacemaker, that's not very effective. And it's worth more for that patient to have a better experience and a shorter wait time than it is for us to go, reduce the number of suppliers and save some dollars.
How often do you go? I mean, you see these medical conferences all the time, and especially with the medical devices. But that also includes things that are not, necessarily most cutting edge, but they're still part of medical supplies. How often do you get out of your four walls there at Piedmont and go to these shows to actually try to stay ahead or try to stay up with, the latest advancements in different materials that you're sourcing?
Yeah, we spend, between myself, leaders, and team members, we go to multiple conferences during the year. I actually have one coming up in a couple of weeks after a much needed vacation next week. But we also go to a couple of conferences in the fall. Like many healthcare organizations, we're affiliated with group purchasing organizations. So we attend that GPO conference. But we make sure we rotate through our staff members to get experiences at different conferences. Myself, I go to at least one or two a year, sometimes more. But I do make sure that I know exactly why I'm going, not just to, attend a conference and see the same things, but because there is, it may be a speaker, it may be specific content. Many times the conferences we attend include reverse expos, which gives us a really good opportunity to have vendors approach us, talk to them. I've never left a conference yet where I didn't get at least one supplier that brought me something I hadn't heard of and I was interested in. And so, I think that's really important. It's important personally, but it's also important to, just engage, right? Because there are humans on both ends. And, sometimes getting out of the conference room meeting environment and to an area where you can have a social conversation can be beneficial in business relationship.
I want to move a little bit to how you're operating internally now. And I think so many of these conversations these days, it's interesting to hear how everyone's using data and using it in ways that we never used it before, even thought to use it, especially with AI. How are you guys using data? And I ask that question, especially with respect to trying to stay ahead of the curve in, just new methods of doing things, and also trying to keep an eye out for what's around the next corner that's going to cause some disruption.
Absolutely. Yeah. So we are, like all organizations, right, very data heavy, and our focus is on data that specifically leads to action, right? It is easy to overload yourself with data. We all know the phrase analysis paralysis, right? So we understand that. We work very well with our business analysts and system analyst data team, which again report up through the same reporting structure to the single leader. I think that's effective. We work hard to leverage technology to help us get the insights that we need to have effective discussions with clinicians and physicians when inevitably we have to consider change from a point of stewardship, right? It would be great if we could go to all the vendors and say, give us a lower price, and they say, okay, sure, but we know that's not the way it's going to work. And so at some point we have to say, hey, if we can consolidate, if we can reduce, here's how we can be better stewards of our organization. But it requires data to get there. My team is probably tired of me repeating a quote that I really like. It's attributed to Abraham Lincoln. It runs, if I have 6 hours to chop down a tree, I will spend 4 hours sharpening the axe. And that is something that we really focus on, right? It's just another way of saying extreme preparation. We know if we have the data that we have been through, we've spent time with, and we know exactly what it says and what it's telling us, and we have thought about the questions that we will get from our stakeholders, that is how we can really leverage it to have a positive and productive conversation, as opposed to just, becoming, I think one of the popular phrases is technologically disabled, right? We just throw a bunch of data at it, but we're not actually saying, we're not analyzing it and saying, what is it telling us? And so that's really our focus here.
Is it helping you measure vendor performance?
Yeah, absolutely. I think that's probably one of the areas that we're excited about growing more in, is the ability to manage that effectively, right? Sure, we can write all the KPIs we want into a contract with a vendor, but unless we can manage it, measure and monitor those KPIs, they're just words on a page. And so I think there's a lot of opportunity, and it's an area that we can partner with our vendor suppliers in, to really say, hey, look, we're executing a contract. By definition, that is a mutual agreement. And so our goal is to define KPIs that we agree on make sense. And if we are also using, technology to help us measure, monitor those, it's going to result in a much more effective relationship.
In the roles that you've had, I was reading, you've played such an important role in so many different aspects of the supply chain, and one being managing vendor relationships. And I want to have you talk for a minute on your view on managing those relationships, because, and I know this from personal experience, and also talking to so many of your peers that are involved and are chief procurement officers, managers of supply chain. It's not always about lowest price, and in fact, it's oftentimes not about, it's just one data point, but it's the criticality of managing and maintaining those relationships, especially with your critical vendors. So what is it that you preach to your team when it comes to managing those and cultivating good vendor relationships?
Yeah, I think primarily for us, Piedmont operates, our CEO established what he calls a plan on the page. And at the center of that plan is patient care, high quality patient care, but supporting that is the balance of safety, quality, and stewardship, right? And so there's always that balance there. So for us, it is consistent asking, how does this balance that quality and stewardship, right? And when we talk about balance, that means, as you mentioned, right, we may not get the lowest price ever for a product, but if we are doing that purposely in order to balance out the quality, say it was a discussion with a physician that says, hey, this is a necessary product and here's how I can prove its clinical differentiation, that we are doing our job and doing it effectively and keeping in mind the patient needs. This is an area where, for us, I try to help my team remember that we have to be willing to say, vendors, let's talk about what we need to make this relationship work, right? We can get the best price in the world, and if they can't deliver the product, it doesn't matter, right? If we don't have the item when we need it. So a lot of that, leads into conversations that, again, many healthcare supply chains have realized the value of, right? Upstream supply chain visibility, back down to your manufacturers. Where are you getting? Do you have domestic manufacturing versus offshore manufacturing? And really understanding where our stuff is coming from and how we can create viable supply assurance, as opposed to rhetorical supply assurance, right? We can talk about it all day long, but we need to be able to follow through with it.
How big is your team? And how are you? Are you centralized, or is it spread out?
We have centralized. So our sourcing and contracting team is 18 people, I believe. But we have, and that is a mix of direct business commodity managers, sourcing analysts, contracting folks, as well as clinical resource managers. So these are clinicians that are supply chain employees. So they really serve as our dedicated liaisons between supply chain and physicians and clinicians, and help keep us honest. When me or my team is like, hey, I'm super excited, we can use this product instead of this product and save a lot of money. and they help keep us honest and say, well, these things are not quite the same, or yeah, maybe so. Let's go find out.
So when you're recruiting today for someone who's going to be coming into your organization, your specific organization, what are you looking for?
So I'll be honest, me personally, yes, I'm going to review a resume. Yes, I'm going to look and see, do you have experience? And as we all know, that may depend on the specific need of the specific role. But for me, we have a very strong culture here. And the culture that I work hard to perpetuate is that culture of giving team members the benefit of the doubt. That is our starting place. And so it's phrased in other areas as assuming positive intent. But that has to be what I'm looking for, is someone that I believe would help perpetuate that culture, who is someone who has said, yes, I'm here to do a good job. I'm here to do good quality work. And I believe, and I will start in the place that I believe my teammates are also here to do that. It's foundational to communication. We all know that communication is and will always be the primary issue that needs addressing when you have in organizations or in any human endeavor where many people are working together, right? And so that is a foundational piece that, I'm really looking for folks that are willing to communicate effectively and understand how important it is to work together as a team.
Yeah. I have 4 kids, 21 to 32, and I worry about, and I'm always preaching about the importance of effective communication, no matter what field you're in. And what scares me sometimes with just everything I'm seeing in the world right now with AI and technology and working from home too much is, I worry that, are they becoming the most effective communicators they can be and should be? Because, I just think it's something that gets impacted by us not being in an office all the time, really interacting with people, and sometimes always doing it over Zoom.
I could roll up my soapbox if I needed to, but I don't think we have enough time. But I do agree. I've got a couple, my boys, I've got one graduating high school this year. And, I had tried to kind of balance out, in my mind, hey, am I being what I saw my parents being when I'm like, what? That's not the way the world works anymore. When I say, why don't you just call your friend instead of text them and wait on the text? And they're like, why would I do that? Right. But it's a humorous example of exactly what you're talking about. Right. And this is what I mentioned earlier, where we have to be cognizant of the potential disabling effect of technology. Right. And we know this from the convenience that technology has created in our lives. Right. You have big areas where people will, maybe a little more extreme, will come back and say, yeah, we don't know how to, every person doesn't know how to go out and grow a crop or something. Well, that's true. It's not untrue, but it is an area that we have to think about when we're looking at how technology enables this. We want to make sure that we don't become so wholly dependent on that technology that we lose the ability to make the effort and drive toward the change needed or the work needed without that technology.
Yeah, and when I think about it, and I totally agree with you, I think about the importance of being able to communicate effectively, and in this world of data, being able to take the data and actually explain it in a way that's useful. And, there are some things that I heard a bunch of people saying that, we stopped measuring this, that, or the other thing because, it just wasn't, it was an interesting data point, but it wasn't a really useful data point. And so, there's sometimes I think there's data overload, and I always, when I'm speaking, especially with a younger person, I have an eye out for, can they communicate effectively, and especially in this world of data, explain to me why this data point is relevant, and how can we use it versus it just being sexy and interesting.
Yeah, absolutely. That's something that we go over a lot. Data has to lead to what am I using this for? Something that we as a team have worked hard on in negotiations is really bringing it down. And whether, I say negotiations, but a lot of times that's a conversation, and there's a negotiating aspect to almost any conversation. And there's a negotiating aspect even to conversations with clinicians and physicians and C-suite leaders in the organization. And, what I challenge my team to do is really bring things down to a binary level, right? Yes or no, this or that, right? If we can get that down to, for instance, in many negotiations, my team and I really focus on, making the conversation about this is good and this is bad, right? And we can help define that and say, hey, this is where we need to be. This is what we call good, and this is what we call bad, right? And a lot of times that can help simplify what we're seeing, because you're right, that data overload is something that is too easy to slip into. I can't entirely get away from my original English degree aspirations. Another quote I really like from T.S. Eliot is, where is the knowledge we have lost in information? And I find that to be extremely powerful and substantial today, because it's worth contemplating as we continue to find new ways to throw data at every issue and concern.
So given your background, your English background, do you have an author that you think was sort of prophetic in the way they wrote and what they saw coming ahead, and what they would be thinking today in the world we live in?
Ooh, that's a good one. By nature, I'm not a big fan of favorites, but I do think it is important. When we're talking about technology, I think it's important for, not everybody, believe me, I've tried with my boys, not everybody is going to be able to want and have the desire to pick up a physical book and read. I think there's something lost there. However, I do think it is important that we recognize ideas that do stand the test of time. So an author that I find a lot of value in his words and believe that they stand the test of time is actually Robert Louis Stevenson. Surprisingly, a lot of people associate him with novels and short stories, but he wrote a lot of essays, and I personally am a fan of the essay format. And, a lot of times, personally, I try to take 20 minutes in the morning before a work day to read something that is not work-related. I find that difficult, like everybody, right? We have the ready accessibility of a pinging phone, but I do find that helpful. And he's one that, I think could be read more, because there's a lot of important thought and consistent revelatory insight into human nature, which doesn't change that much over the millennia.
Well, listen, we're out of time. I really enjoyed this conversation, and I look forward to staying in contact with you, and wish you a lot of luck down in Georgia at Piedmont.
Thanks a lot, John. Thank you for the opportunity.
And for everyone listening and those watching, thanks for tuning in to Smarter Sourcing. My name is John Pavia, and we'll see you on the next episode.